Friday of the 2022 Triad Conference, sponsored by Triad of Wisconsin and RSVP of Dane County. My name's Leslie Fox. I'm a mental health deputy with the Dane County Sheriff's Office and a Triad Conference Committee member. A few housekeeping items before I introduce our first speakers. If you have a question during today's presentation, please use the Q&A or chat box. We will monitor both boxes and will bring the questions to our presenters' attention near the end of the session. Additionally, during this first presentation, we'll also have some poll questions that will be posed to you during the presentation. If you're planning on submitting for continuing education hours, attendance certificates will be emailed 1 to 2 weeks after the conference ends. You can expect these by mid-November. Finally, we will email all participants a survey after the conference series ends. And actually, I think this will be sent out the end of next week. We hope you will take a few minutes to share your feedback and suggestions for next year. So our first speakers today are from the Collaborative Stabilization Coalition. And I'm also a member of that committee, and they're doing great work. So their presentation is working together for a better dementia-informed community crisis response. The Collaborative Stabilization Coalition of Dane County works to stabilize, educate, and support adults living with dementia or other cognitive impairments in an effort to reduce their risk of crisis. This presentation will begin with an overview of the CSC, including debrief and other work groups. Then the presenters will discuss the CSC's crisis response decision-making flowchart and crisis response continuum resource. Finally, they look to the future, taking up the community dementia crisis prevention conversation and some recent ideas, as well as comments, questions, and answers from attendees. I would like to introduce Beth Freeman and Monica Baer from the Dane County Department of Human Services, and also Teresa Fischler with TMF Consulting.
Great, thank you, Leslie, for those introductions. And again, my name is Beth Freeman. I am currently the manager of Adult Protective Services with the Dane County Department of Human Services, and am one of the co-facilitators of the Collaborative Stabilization Coalition, which you may hear us refer to as the CSC throughout the presentation. And I'll introduce Monica.
And I'm Monica Baer. I also work, as Leslie said, at Dane County Human Services in the Disability Services with Beth. I am the co-chair of the Collaborative Stabilization Coalition and representing the disability part of that coalition. And Teresa has been our awesome project manager. You go next.
Absolutely. Thank you so much. My name is Teresa Fischler, and I have been working with the coalition since 2019, and you'll hear more about our history in a minute. As a project manager, my experience over the years is working with folks with intellectual disabilities as well as older adults. And outside of this work, I also teach part-time in the School of Social Work at UW-Madison. Great. So let me share our presentation and we'll go forward.
There we go. And you can see that. It's all good, Teresa.
Yeah. And Leslie has talked, kind of introduced our agenda already, but we hope to give you an overview of the work we've been doing for the last few years and get some input from you, and at the end have ample time for some Q&A and feedback. So I will start by actually just reading our mission statement, because the word crisis, I think, can mean lots of things to lots of people. The Collaborative Stabilization Coalition of Dane County are leaders working to stabilize, educate, and support adults living with dementia or other cognitive impairments to reduce their risk of crisis. We formed in 2019 with the help of a state innovation grant for crisis prevention, specifically aimed at reducing the amount of emergency detentions in our state mental health facilities, and just an overall better response for folks with dementia and IDD, as I think the members all, I think, have come together realizing that our community response might work better for people with behavioral health, challenges exclusively, but when you throw in the added layer of dementia or disability, it can kind of throw a curveball at people, and they don't always feel confident and competent in their response. So we the coalition, I think the collaboration is what we're really I think kind of put a lot of attention and energy is making sure that we have wide representation of folks who work with those populations. And we formed about the same time, a year after Dane County's long-term support was reorganized from locally run to the family care and IRIS model. So we have representatives from all of our local long-term care, managed care organizations, as well as all of our IRIS consulting agencies that operate here. We have content experts in both dementia and IDD, sort of local, agencies that specialize in that. And because so many behavioral health crises involve law enforcement and our emergency services, we also have both Madison, our largest, metropolitan law enforcement unit, and the other biggie, Dane County Sheriff's Department that Leslie represents, and our emergency services unit, which for us is Journey Mental Health. So we've had to do some pivoting. We started in person, we've gone online, we've adapted sort of like the rest of the world has over these last two years. The definition of crisis, once again, I sort of said crisis means a lot of different things to a lot of different, people. I think it's as much a feeling in the moment of not being particularly confident or competent when there's something that's gone awry. But specifically what we were interested in and continue to be interested in as a group is acute episode or series of events that destabilize a person to the point that they may be viewed or are considered to be unsafe to themselves. As a result, they're at risk of being moved from their home to a more restrictive environment. So when people are at risk of, hospitalization, maybe law enforcement involvement, and where they're living isn't feeling like something they're able to, to deal with, and their home becomes at risk. The activities that we do as a coalition are outreach, so talking about this at events such as this, reaching out to our local partners and providers in Dane County, really working on collaboration, identifying a point person within each organization that when you're hearing a crisis and you're having trouble getting to the right person within a large organization, there's a point person you can call that will help make those internal connections. Lots of effort about how our populations of dementia and IDD might be able to access behavioral health resources so that and maybe adapt them in a way that will prevent or reduce those emergency detentions. And part of the proactive work is training series. We have a dementia training series, as well as IDD, on crisis prevention and understanding those conditions and how they might impact what a crisis looks like, and some, techniques. So they tend to for de-escalating situations. So we have trained 1,400 people have gone through one of our training events since 2020. So they have been very popular, very well attended, and we hope, having some impact on educating our community during tricky times. And then I'm going to let Teresa talk a little bit about some of the accomplishments that our coalition has accomplished since 2019.
Great, thank you, Monica. Yeah, so the time frame of our coalition's activities, we started in mid-2019, and of course, as Monica said, we pivoted in all sorts of directions during the pandemic. But I think our group is a group of stakeholders that are really engaged and working on building communication and kind of addressing some of the issues that we'll be talking about. So after our coalition formed, we created our mission statement and defined crisis, and our CSC, as we call ourselves, steering committee continued to meet monthly. And the steering committee is really important to build those relationships and lines of communication, but they are also our stakeholders. And so work on setting the direction for our coalition going forward, be that in the form of training. As Monica mentioned, we have an IDD training work group, and we have a dementia focused training work group. So those work groups are responsible for developing and delivering training, but the steering committee is very instrumental in providing the feedback about what the needs are and the direction for training going forward. So our steering committee meets monthly. We've been meeting in Zoom. We meet in person about once a quarter, which has been great. And we use those in-person meeting times to maybe dig into some discussion or some work that having people sitting around a table together just lends itself to some really rich discussion. We also have our crisis debrief subcommittee that was formed early on in the coalition's activities. And that work group is really, really important for providing a space for folks who have been through a crisis situation, and their team, their support, their family, the people that are important to them, to come together and debrief what happened. And the members of our crisis debrief committee are members of the steering committee. They might be community members, people that have experience and are committed to improving the community response and how we go about supporting folks to prevent a crisis. So that group meets monthly, and we alternate. So 1 month we might be debriefing a crisis situation that involves an older adult or a person with dementia, and then the alternate month from that, a situation involving a person with intellectual disabilities. We're really engaged in active learning about what's going on in the community. We often have had guest speakers come in to talk about, for example, we recently had someone from the Department of Health Services talking about new mobile behavioral health crisis initiatives that are happening. And so, and we have had roundtable discussions with other grant recipients. So we really want to learn and be engaged in learning about what is happening in the community and where we can be a partner. our work, we've also formed some kind of work groups around specific issues. We've created a best practice transfer protocol, which Monica alluded to, where each organization has a point person, so that if you are starting to work with an individual, you can get information from folks who have worked with individuals in the past. And we know that the point of transition can be a potentially destabilizing moment for individuals. And so this process has been really helpful to identify the key pieces of information that are important to have at the point when someone's transitioning, but also trying to eliminate the situation where a person's story is retold and retold, and that story instead can follow the person, and we're informed.
And
We
Teresa,
also,
can I
yeah.
just add to that? When we're talking about transitions, often that involves a person who may be entering a new long-term care program for the first time, or it may be that a person is, when we say transition, they may be in one program and then making a choice for whatever reason to go into another program. So it's that transition of information that we want to follow the person. So I just wanted to clarify that. I hope that's okay. Thanks. Teresa.
Yeah, absolutely. Thank you, Beth.
And if I can just add for a sec too, when Teresa was talking about the active learning, one of the areas that we've really focused on in terms of exchange of information is with some of our community partners, specifically in the behavioral health world, that are very accustomed to behavioral health crises, but less familiar with what they look like with folks who have dementia and IDD, and trying to provide some of that support and learning to them, and giving them contact points as well.
Absolutely, thank you. And I think this is a great example of the collaboration and that we are really striving for, that no one of us knows the answer to everything, and it's that sharing of information. So thank you for jumping in. And a couple of other accomplishments that I want to touch on. We had a work group that worked on really thinking about a framework and a way to approach behavioral support planning from a best practice, person-centered standpoint. Also had a group that looked pretty deeply at the magnetic lock guidelines, knowing that those are used in some instances for safety purposes, but creating a process and guidelines for people to follow that are safe and person-centered and used in the least restrictive way possible. We had a crisis planning summit in April of 2021, which was really in Zoom, an opportunity for us to have a guided discussion to help do some visioning and goal setting for our coalition going forward. And, we put a little more structure to our coalition after the grant funding ended. So we have bylaws and we have an annual work plan. So we're trying to keep the wheels moving forward in terms of our activities. One thing I wanted to point out at this point that really kind of leads to our future goals, and that is we have data from Dane County that has tracked over the last 7 years the instance of IMD admissions for individuals with IDD or intellectual disabilities, as well as frail elderly older adults. And I mean, this data is showing us that over the last 3 years, we really are seeing an uptick in the instance for older adults, frail elders, individuals having these admissions. And the reason that we're in this work is to try to prevent this from happening, but we are seeing, as you'll see on the chart, since 2019, between 15 and 17 people per year have been admitted and hospitalized due to crisis, for anywhere from 515 to 778 days per year, with readmissions. So folks going into a hospitalization from the setting where they are living and coming back to the community, but having another crisis incidence. And this is the work that we're committed to reducing the instance of these emergency detention and behavioral health crisis for folks with IDD and dementia. That's our mission. So we're continuing to work on that. We also will continue to partner with organizations and other groups working on crisis response, really for system change. We will be continuing to provide crisis prevention and person-centered training for caregivers and people working with folks who have dementia or IDD. We will be working on creating a crisis response resource guide, which will show you a couple of components of here shortly. And we will be hosting a crisis summit, which is an in-person summit. This is a hot off the press date confirmation for all of you. So February 16th, 2023 at the Alliance Center in Madison, which will really be a day of training for folks on different tracks related to dementia as well as IDD, and giving us an opportunity to extend this conversation. So if you're interested in the coalition, the opportunities for involvement are all those committees that I just went through. Coalition membership is voluntary. We don't have any dues or annual fees or anything like that, but really we're looking for this group to be a group of people that might be really want to dig in and work on these issues. So coalition membership is voluntary, but we really would like to have at least one representative from each stakeholder entity attending those monthly steering committee meetings and participating in work groups. So with that, I will turn it over to Beth and Monica again.
Great. Thanks, Teresa, for that overview. So as Teresa indicated, we've been trying to work on some resources to support our community in knowing kind of how to think about a crisis, and then also where to turn to help. So we'd like to start with a document we're working on. We're sharing this today. It's still not a final document that we'll be sharing broadly, but definitely anticipate that being the intention of this document, and also looking for any feedback on this. And I'll say right off the bat that the print is a little small, so we've tried to make it larger, but we're not able to, but we'll talk through it. So one of the things our group wanted to do was scope out what are the resources that support a person, kind of looking at the stages of a crisis, looking at the proactive elements of a crisis, what's available right in the moment of a crisis, and then sort of post-crisis, what are some long-term long-term interventions or resources. And when we had our summit in April of last year, I really like some terms that we used of kind of a slow crisis. So the slow crisis might be those things that are bubbling up. What can we do to prevent it from becoming fast crisis, kind of in the moment, things have to happen right now to get an individual safe. So that, like I said, the goal of this continuum, we've divided it into 3 sections. One column being crisis prevention, the second being crisis response, which we'll talk about because you can see it's not fully developed. And this is informing the work of our group. And then lastly, kind of long-term or ongoing resources that may support a person after a crisis, moving forward. And so in knowing the focus of our group are both persons with dementia and or intellectual and developmental disabilities, we then, going horizontally, mapped out what are those resources that are for each of those populations and those that might overlap between both of the groups. And then those that are, again, specific to the disability resources. And I'll add to what Teresa and Monica said, the learning that has come from crossing over our disciplines has really been important for the progress of this group. Too often, just based on the nature of our work, we work in the, populations that we're serving in any of our given roles. But this coalition has allowed us all to learn about each other's work, where there's similarities, where we can learn from each other. And I think that's been one of the biggest benefits I think that will bring to our community, as well as we support individuals. So the intention of the continuum, excuse me, is not to be all encompassing. It's not a decision tree like if this, then that, because we kind of started down that road and it was just too in the weeds because there's so many nuances and ways in which resources are accessed. So we tried to provide in general those entities that could support a person, a family, an agency, in preventing a crisis, during a crisis, or afterwards. And later on, when you see this, there's some shading for some certain programs, and that's intentional because there's some programs that you can't make a self-referral to. You need to be specifically enrolled or referred to a program in order to access the services. So we also wanted to delineate that so that there wasn't confusion, when we put, for example, the managed care organizations. Those programs are, you might hear My Choice Wisconsin, Community Care Incorporated, TMG is an IRIS entity, but those you have to be eligible for and enroll in. That doesn't mean they're not a resource to you, but there's just different steps by which you have to access those. So this is a starting point, and I think it was very telling when we look at the middle column. Our community needs more specific resources to support both of the populations in the moment of crisis. And that is really, as the Adult Protective Services Manager and having the aspects of dementia-related crises falling under that umbrella, we've got a lot of work to do. And it's being planned for, 2023 and 2024, because clearly we've got some holes that I think doing this project helped us identify where we need to develop more supports. Monica, is there anything else you would want to add to this?
Yeah, and sort of focusing on that crisis response column that Beth has noted is perhaps a little thin on options. What's also true is I think like in that moment when people are, at danger to themselves or others, like the resources are kind of the same for everybody in the community, regardless of whether you have that extra layer of dementia or IDD. And kind of what this showed to me is if that's like truly the emergency response in that moment of potential harm, there is that need to make sure that our partners have some familiarity and some confidence and some maybe knowledge, not that they need to be experts in dementia or IDD, but they kind of in the moment need to at least know enough not to do any harm, and then like after that's over, what's next as people move into those, other columns of ongoing, or, how do we prevent it in the future? So for me, that's sort of one of the lessons I learned or took away from doing this exercise. So for example, in Madison, there is, for people having behavioral health crisis, that CARES team is, first responders are a paramedic and a mental health specialist. And so wanting to make sure that those folks have, some knowledge about dementia or IDD. Our community is working towards developing a triage center where people then, who need a place to go for that, 12 to 24 hours go. As that develops, we're also wanting to make sure that those people have knowledge of us and maybe some of our specialized knowledge.
Yeah, and I think this document will be our intention would be to make it kind of a living document, knowing that, programs and resources and responses may change over time. So I would imagine that one of the things our group will do as we develop this is to continue to look at it as part of our annual work plan to make sure it's up to date. And then once we get like I said, once we get this finalized, wanting to make sure this is a resource to help professionals, social workers, care managers, those sorts of folks in the field supporting these populations to kind of help support them, because in that moment, what can I do to think about? And so as a companion piece to this continuum, that which kind of looks at the potential resources available, we also worked on what we call a roadmap to help. And so this is not so much resource focused, but instead the intention is to kind of think about the situation and prompt questions that may prompt or help a professional in the community to understand how do I keep the person in crisis at the center in any situation, and what are some of the key questions I might be able to ask myself or that person as I look at a crisis. So again, I apologize, this is small, but so to prevent a crisis, asking the individual as much as possible, even people with dementia or IDD, have the ability to express what's important to them. So what do they want? Where do they want to live? Asking yourself or others, does the person have a history of behavioral health issues? What might I need to be aware of as we look to the future and where they're living? Are they connected to a primary care physician? Do they need to be connected to psychiatry support? Some of those things. And then based on the questions, maybe calling the Aging and Disability Resource Center, talking to a physician, some of those things you can do ahead of a crisis moment. And then kind of the next phase, looking at, well, what if I'm in a crisis and somebody's really not at safe right now? Again, is there the opportunity to ask that person, what would help you right now? What do you want right now? What can I do to assist you? And then some of the things we always ask about, and Teresa talked about as one of our work accomplishments for the group, is the importance of having a behavioral support plan that is done before a crisis happens, so that those supporting the person kind of have a reference document of, okay, what helps this person calm in the moment of crisis? Is there someone they want called in crisis? Those sorts of things that you can't get at in the moment of a crisis. So when asking about a crisis plan, is there a medical crisis? Is this something that needs to be ruled out as a physical reaction to some sort of issue? And then if all else fails, then there's, is it a 911 situation? And so then determining that you need to call for immediate help or call the Journey Crisis Unit for immediate behavioral health support. And then similar to kind of our debrief process after, and supporting, so that it's supporting the person through the whole process. So if there's the opportunity after something has happened, how did that go for you? What could have been different? What support, if this happens again, what could we do differently? Is there something we should know about, or asking a caregiver, important support person to that person? It doesn't have to be family. It's just, who is that person's, as Monica always likes to say, who's their champion? Who knows them? Who would be the one that could help support and inform that information? And can the person return home safely? What do we need to consider to make safe for that person? Because that may be different for each individual. So again, that may lead to connecting again to the Aging and Disability Resource Center. It may be connecting to Journey Mental Health, as they may be able to provide some support in writing crisis plans. Our police officers, the sheriff, the mental health officers in Madison are really valuable resources too, because can we have the individual get to know our local law enforcement, so that in the moment, maybe there's a relationship, or the police then have a better understanding of who this person is and how to best support them in a crisis. So that's the intention of the roadmap, is to sort of help us break down what are the ways I can look at a crisis. Because as Monica said, a crisis can mean so many different things at any given time to a person. And so that's our intention with that. Anything else, Monica?
Yeah, just focusing on that. Can the person return to their home safely? So often after a crisis, I think people's reaction is to say they can't return home. So it's like, what would it take? And maybe grappling with that. I mean, what we've on the data slide that Teresa showed, what we see is fewer and fewer people over time returning to their home. And for some folks, it's not a possibility, but other times, with some modifications, with maybe a change in support, it can be looked at. And I have a cat trying to get into my office, and it's making a very loud background noise, so for that I apologize. But I think that's the, like, what would it take? So often people want a magical place that's going to fix somebody, and the reality is crises, as Beth said, there's that acute moment, but there's the slower stuff before and after that we also need to take a look at, because often a new place that doesn't get at the underlying issues, and we often get in that cycle then of, okay, that was the wrong place, what's the next place, as opposed to what can we do here?
Being creative and open to how do we adjust to the person, rather than, so like Monica said, so often we're taking the person out of what is their setting and trying to make that, but what can we do, if at all possible, to help people if they have a home of choice they want to be in? How can we support them to be there? So I think looking at the time, I think we're right on track. So what I'd like to talk about is, so having this information in the work that we've done, there's a lot. We're very lucky, I think, in Wisconsin, in our community. While there's work to do, there's people trying to do it. So thinking about moving forward, just in case folks don't know, so the Department of Health Services has a state dementia plan steering committee, and they have kind of 4 key areas that they're working on to help inform the state. And in those areas are care in the community for persons with dementia, healthcare related needs, facility-based care, and then crisis response. And that's the area we wanted to focus on. So the state had developed its first plan, which went from 2019 and then ends in 2023, again, focusing on these 4 areas. And they're currently work groups meeting. There's a work group for each of these 4 areas, including the crisis response. and they're developing the next plan for the state. So I believe it's from 2024 through 2029. And this crisis group is made up of, again, stakeholders from across the state. I think our next presenter is part of that. We have some representatives from our Dane County area participating in that important work group to help inform, from the work that we're learning from our community and from this coalition, what would we want the state to know as it's developing kind of its framework for supporting people with dementia in our area. So we have a couple of poll questions that we'd like to start with to sort of get us thinking. So the first one is, and I'm assuming it will come up, but we're curious of the participants here. Have you or a loved one, have you had a loved one or someone you care about experience a behavioral health crisis? And then based on that, if yes, where were they living at the time that the crisis occurred? So if folks want to go ahead and take a moment to answer those polls or those questions, then we'll just see what the response is. Just curious what folks' experience has been. And I'm assuming, so I can't vote. So I'll wait for the results to come in, Mike, or someone let us know when.
And while people are taking the poll, one thing that we should have shared when we were showing the roadmap and stuff is those are still in draft form, so we won't be sharing them as handouts to the presentation. We will have them ready for debut probably by the time of our Crisis Prevention Summit in February.
Okay, great, thank you. So a large number of you have interacted with the crisis, 81%, living alone in their own home, living with others in their own home. And it's interesting, less from assisted livings. And one of the roles in Adult Protective Services is a dementia crisis program specialist. And I think her experience has probably been more in assisted living, but yeah, and that's really hard, any of these populations to do this. So following up on this, one of the things, and the reason I should back up why I'm asking, I kind of jumped ahead. So as part of the crisis work group of the dementia, state dementia plan, is in order to inform the new plan, the plan that will be developed for 2024 through 2029, which is crazy to say. They're wanting to gather information from the community. So I don't have any dates of anything happening here in Dane, but can share those. But they're sponsoring and encouraging some community conversations about this topic. And there's also an online survey that I think will be put in the chat that you're available to take as well. But we thought this was a good opportunity with this group to get some general feedback of what folks in our area are seeing. But we do hope to have some other opportunities for the Dane County community to give their feedback about what they might want to see. And then we can bring that information to the state to help inform the plan. So I'm sorry, I kind of jumped over the context of why we were having these polls today. And then, so again, following up on the questions about experience a crisis and where the person was living at the time, if in the Q&A, and Leslie's going to help monitor this, at the time, if you can think of what was the most helpful intervention you encountered during that crisis. Was it another family member helping the person? Was it a police response, a caregiver that got called in to help support you? So if you can, think about that, what was helpful, if hopefully there was something that was helpful in what can be some really challenging situations. So if anyone doesn't mind putting a comment, we'll keep an eye on those to see what the responses might be and what we can learn from you as to what may have been helpful. I'm seeing a family member who was able to support family, emergency, EMS responders. Thank you for taking the time to enter that into the chat. So you can go ahead and, family member with nursing experience, always so nice to have a nurse in the family. I have to say, being a social worker in the family, I'm that kind of that go-to. So I can appreciate important roles within our families. Someone who knew the person, so important. That there's someone who may be, again, that champion who, even with families or people living alone, when I think about us as community partners or supports, how, if at all possible, can we work with an individual who may be at risk of experiencing a behavioral crisis or just anything? Is there anyone who's their champion, who knows them, who would be willing to, maybe pop in, and I know that's not always possible. So thank you for sharing those comments. And then go ahead.
If I could also add, I think that history of the person is, and you talked about that, Beth, but I also think that, the history is important to know, what we're seeing today with this person. Is it vastly different from a year ago or 2 years ago or last week? So having that time frame perspective helps, I think, us understand what's going on with the person at the time and how it compares to what they have experienced most recently.
Yeah, and I would say, also having been a case manager in the community, we're seeing a person at one moment in time in their life. We may work with them for 2, 3, 4, 5, 6 years, but it's just remembering that person is much more than just what we're seeing based on the role that we have with that person in that time. And so I think that speaks to what Teresa is saying, that we don't know everything just from that period of time. And it's really important to understand from where that person has come to this point. Have they had traumatic experiences in their life? Were they in the military? Just different things that really we need to try and understand so that we can help individuals. Yeah. I think any of us could be on a soapbox about this for a while. So just really want to reinforce that. And I know you all attending understand that.
Yeah, the ability for relationships to keep people safe can't be underestimated.
No. And so lastly, the last poll question we have, and this can have more than one answer, of the following options, what do you think the next state dementia plan should focus on to improve dementia care in Wisconsin? And pick whatever, any or all, that you think could be helpful to our community. And actually, this question comes straight out of the survey, the online survey that the state has put out to help inform them of their work. So these are the things they're considering, and it would be helpful for us to be able to, again, take our feedback to inform them of what our community here in Dane thinks about, because this is certainly not a Madison issue. This is a Dane County need. So I just want to be clear about that, because Madison can take the air out of the room sometimes, and we want to make sure that's not the case. So we'll give you a couple of minutes to answer that while Monica calms her kitty, who is much happier being part of the presentation today. Okay, I guess if we want to go ahead and put the poll up, we've got about 10 minutes left here. So, all right. So it looks like the key one was provide more local community support for people living with dementia, followed by improve help for persons with dementia experiencing a crisis. So thank you, that's helpful. All of these, quality of care for people living in assisted living settings. So that helps, kind of, I think those, all tie together in terms of a crisis response, because what our local supports are could directly impact whether or not people do experience a crisis. The care that people are receiving in an assisted living setting also can directly impact whether or not a person may or may not be more at risk of experiencing a crisis. So this is helpful. Thank you. And we'll be able to save this information that you've all shared. So we appreciate you taking the time. So we've done a lot of talking for the last 50 minutes, and we just wanted to take a few minutes if we could, unless there's anything else, Teresa or Monica, that we need to touch on, but just to see, if you all have any questions for us, they can be put in the Q&A, and then we'll monitor that, and Leslie can help us as well. And if not, we can just sort of help pose some questions as well for you to think about as we wrap up this discussion. Anyone want to shoot a question our way? Here we go. Okay, so Vicki, thanks for sharing. I think education in facilities is huge. I've been a CNA for over 10 years and never received specialized education on how to care for patients with dementia or Alzheimer's. Unless staff are working on an Alzheimer's or dementia specific unit, not sure they're receiving the needed education. And sadly, those residents with dementia or Alzheimer's in non-specialized settings are falling through the cracks. So thank you. I mean, and that's one of the reasons we know training is so important and just has to be an ongoing part of our coalition. We don't have the luxury of kind of providing a training and thinking, great, we had a training. And that those need to be recurring, and that's the intention of the group. And I know for the dementia side of things, we will be having 2 trainings next year, one in March and I think another one in October, and we'll get information out to you. But and given changes in caregivers and just everything these days, we really are focused on trying to do that ongoing. So thank you for that comment.
And if I could, and if I could tag on to that too, Beth, the trainings that you talked about, we're talking about having trainings for direct support providers, as well as, supervisors or managers, knowing that training is part of a culture, and that if we can offer training to folks at different points in an organization, that we're trying to help build capacity, learn from the organizations about what their needs are and the folks they're supporting and what the needs are of the folks they're working with, to be able to work with individuals over time, knowing that individuals with dementia, their needs change over time. And so we want to be flexible and nimble with that. And yeah, I really appreciate that comment that you put in as well. That was wonderful.
Here too. Wondering if the best practice transfer process protocol is something you can share. We do something similar when discharging patients to facilities, but is very basic, and we'll be interested in what you do. Thank you. There was also a previous question about if the presentation slides could be shared.
Sure. And I think, we can share the slides. Unfortunately, it'll be just the Continuum and the roadmap. We'll have to get out to everyone at a later time, hopefully, like Monica said, in February. I think the best practice transfer process, we can share it. It is specific to, like I said, those transitions that go between long-term care programs. But at the same time, I think there's content and sort of context that you certainly could pull from that and tweak to as part of your consideration when you're discharging. So I think it hopefully could be easily sort of adapted.
And what I'm wondering is if maybe Tess can either put in the chat her email, or maybe get it to Leslie. Yeah, to provide some context and maybe some dialogue about
how we use it.
Yeah, and how we use it.
Yeah, absolutely. I think it would be a really nice template to modify based on your situation. And I think, you know, there's a lot of information that collectively our coalition identified as being really important to share during those times of transition. In addition, you know, we have a point of contact list. So, you know, thinking about the organizations where, you know, people may transfer from or transfer to, and in your setting, what do those look like? And then identifying key people within each one of those organizations to be a contact person for questions, or at least getting information started flowing in the right direction. So yeah, I think we'd be happy to share it. And I think it would serve as a template that you could modify for your situation.
And the one thing I think that we have people report as sort of the biggest challenge when you're in the throes of a crisis, it's like you never feel like you have enough information. And so often in transitions, that's what doesn't follow. Like your knowledge starts the day you met them. And what was, you know, what were the important lessons learned in those weeks, months, years that led up to the moment you met the person?
And then a comment, it would be nice to see education on this topic required as part of keeping CNA, RN, LPN licenses, especially if working with the elderly. And then I also have a question in the chat. Do most sheriff's offices in Wisconsin have deputies with training in mental health? I don't know for sure. I do know some officers outside of Dane County that have specialized training. Obviously Dane County, we have quite a few. So City of Madison, our department now has mental health officers. And I know some of the suburban agencies around Dane County also have sort of a specific point person. It's more of a community or mental health officer as well. Around the state, I couldn't give you an accurate answer. I know from a recent conference I spoke at earlier this year, that seems to be the trend moving towards that. Yes.
And just lastly, I know we're just about at time. Our contact information is on the last slide. We should add yours, Teresa. But Monica and I are the, you know, feel free to reach out to any of the three of us. We'll add Teresa's contact information. If you have questions about what we've presented or any interest in participating in a debrief, we're always looking to have situations that we can process together. So we really appreciate Leslie and the Triad asking us to present today. So we appreciate your time and support of the work we're doing.
Yeah, thanks everybody.
Yeah, it's been great.